We don't have a large team, so capacity for us was an issue. So it was really good in terms of being able to have some external help and expertise, particularly in an area of work that we hadn't previously developed. So our work around public health and social care, which is something that we wanted to pursue, it was a great opportunity for us to get involved in the project because we'd worked well with Sport England previously. We know that in order to make a step change in terms of trying to encourage people to take part in physical activity, the benefits for people's health will be achieved most in the areas where people don't take part in activity, essentially those areas which are more disadvantaged. Key to the involvement of chief officers and members in this project were the executive lead member for our service area and the director for a number of our services, including community services, social care, health and housing and children's services. We were able to engage them and to encourage them to be involved and to provide support at a lower level, where we were able to then interview people across a number of service areas within those directorates. That meant that we had some buy-in at the strategic level and an understanding across the organisation about what we were trying to achieve. We quite quickly found that there was a keen interest in what leisure services could offer, how we could perhaps influence and support the outcomes that they were responsible for. And quickly it became clear to us that they didn't necessarily know very much about the service that we had to offer. We've been able to strengthen the relationships at the Health and Wellbeing Board, and we've been invited to take part in the refresh of the Health and Wellbeing Plan. We've got physical activity now embedded into 3 of the 4 areas of that new plan, including the support for frail older people, the support for healthier, longer lives, and the support for mental health and wellbeing. Which is great news for us because it shows that physical activity is seen as a way of improving people's long-term outcomes, which wasn't necessarily seen and understood before. We've been working with Mind and the voluntary sector to support service users using our libraries as a basis to start walks from. Another operational example is where we've been able to pilot lifestyle hubs from our leisure centres. So that's working with public health to deliver those services in a way that haven't been delivered before. So for example, dementia care or flu programmes which are developed through the winter, they're now advertised across our leisure estate. We've brought together a library and leisure service with countryside access, and we've created a new team around active lifestyles. This has created additional resources and capacity for us to be able to really put more efforts into developing further the physical activity strategy. Another way where we've been able to build on the successes of the project have been where we're now working with the new providers for mental health and drug and alcohol contracts, so that we can embed physical activity into the everyday opportunities for those service users to help support them through their recovery pathways. Also, where there are opportunities to redevelop our physical infrastructure, we're looking at how we can co-locate services. So for example, at Dunstable, where we're redeveloping the leisure centre, we're now looking at a scheme which will bring the library and the leisure centre together, but also work with social care and health to embed the Lifestyles Hub and some daycare services for older people, which will then be able to redirect those service users into the leisure and the library services straight away because they'll be under the same roof. Working with housing and social care and across the public health colleagues in their directorate, we've been able to explore opportunities and open up avenues that we would otherwise never explored.